So what we've been doing is taking CAT scans, which most people know what that is, and they're very frequently done now, and taking the unique data that comes from a CAT scan, which is very detailed. It's a group of X-ray slices that the average person couldn't make sense out of. And taking all that information that we get, put it all together with computers and generate essentially a model that anybody can understand. Patient, physician, and it can be made in very detailed referencing, which is basically the patient-specific anatomy. It's not like a make-believe type of model. And as a result, when it comes to treating a type of pathology, we can optimize what device we're going to select, how long it's going to be, what the best technique is for that particular patient, and come up with patient-specific solutions. One of the great things about these print models we've been talking about is the physician actually did it. You didn't have to go out to a PhD sitting at a university to make the model and manipulate the data, or to a specially trained a technologist that may be in a 3D lab. With this new software that we've been evaluating called D2P, I was actually able to sit down with the CAT scan as I would if I was just evaluating the patient's CT scan, and very simply create the data set, the information that could be then sent off to a third party to be able to make those prints. So what it's doing is putting in the hands of practicing physicians the ability to actually generate those 3D models exactly the way we want them to be, to show us the information we need. It also seems to be very helpful in getting patients to understand what their problem is. Lots of times we're drawing sketches, we're describing things, and we think we're describing it well, but for a patient to hold a three-dimensional model of their leg or their abdomen or their whatever it is, with an aneurysm or a blockage or a bad heart valve or whatever it might be, is very impactful, I think, in the patient really understanding what their problem is and why they need to be treated. This particular patient was probably the first one where we did the model in advance to show the individual what his pathology was. And it was a pretty interesting experience, I think, both for the patient and for me. I've been meeting him a number of times in the office, drawing diagrams, explaining not only what the pathology was, but explaining what we had to do to treat him. But clearly the lights went off in his own mind when he saw the model, saw the aneurysm, understood what the problem was, understood where the branches were, what the risks were, and everything seemed to click from his perspective. So I think it's going to be a very important piece of how we get our patients to understand complex disease. I think the model is going to help us make the right treatment decision. So there's the patient education piece, then there's the physician education piece. Sometimes what we're used to doing is looking at a CAT scan and extrapolating the 3D information in our head and making these things in kind of a virtual kind of way. Being able to see a 3D model shows us a lot of things, especially as it relates to heart and circulatory problems. When we're treating aneurysms, arteries curve a lot, they angle a lot, they're very complex. And we've seen a number of situations where by looking at a model and looking at the 3D model, we actually change our device selection or change our approach or in some way alter our treatment plan for that patient. So I think it's going to offer a lot of potential for improving patient care in that way. In terms of technology moving forward, we're beginning to see things like virtual reality, where we can actually look deeper into a model and be able to really understand it in a real way. And in short, what we're doing, if we're going to treat a patient with some sort of invasive therapy, the more information we have, the better we are to be able to pick the right device, pick the right solution, and so on. And when we talk about minimally invasive therapy, what that really means in general is that we're looking inside the body somehow, minimally invasively. It all involves imaging, CAT scanning, MR. And so to the extent that we can see inside of someone and get the most information and actually create models of that pathology so we can understand what's going on, we can also understand the impact of what treatment we're going to be providing and what the best solution is. Now that we can make models so simply, and when we start looking at what these models look like and see what they're like in the patient's hands, we know that this is the beginning of a development pipeline for other technologies. I think to the extent that models help us understand what the patient's pathology is, allow us to kind of run the racetrack before the race with having patient-specific anatomy, so we can actually treat that specific patient in a virtual way before we actually treat them, are going to make us all better practitioners and hopefully in the end result in better patient outcomes.